speakers were laughing from the back. We're wondering if we could ask you to move out a little bit more so we'd be a true Poisson distribution. I really appreciate the opportunity to come and talk with you, and I particularly appreciate the chance to talk a bit about framing, what I consider to be a very important topic. That how we frame an issue, how we approach it, what kinds of information, perspectives we come in with, really determine then what we do with an issue and what the results will be. I'm sure most of you are looking at this trying to figure this out. I hope a few of you have figured this out. It's a useful way to illustrate this. It's a very old map. If I turn it on its side, it might be helpful. You can immediately see that it is an old map. It's a woodcut, actually, of the UK. The first one was done by the Germans. If you could read the text at the bottom, it starts with the German Ocean. And so your perspective, how you frame things, are really important, particularly in such a complex issue as climate change. So I want to start with two framing issues that are important for thinking about adaptation. The first is a framing that is being used more widely now in the field, is climate change is a wicked problem. We need to get away from the rhetoric that climate change is a problem we're going to solve. We're not going to solve climate change. Tony talked about that quite a bit in his wonderful lecture. Wicked problems, it's a phrase that comes from social planning. I've got the definition up there. It's a problem that's difficult or impossible to solve because of incomplete, contradictory, and changing requirements. It's basically a three-dimensional chess match with climate change. We don't understand our current challenges, we often don't understand our current exposure-response relationships, and we don't really know how those are going to change into the future. When you look at trying to manage the risks of climate change, there's complex interdependencies that you need to take into account, and you often can't resolve all of them. That when you look across all the sectors, for example, water use is a big issue in many parts of the US, many parts of the world. California, where I used to live, you've got cities that want access to drinking water, you've got fishermen who want to be able to go fishing, you've got agriculture that wants to be able to irrigate, and there's not enough water. And how do you start managing these complex interdependencies? And so when you start thinking about climate change as a wicked problem, you start thinking in terms of how can we make things better or worse. So we set our goalposts differently. We want to make things better within the context of what we know, understanding what we know is going to change over the course of days, weeks, months, and years, and we will revisit our decisions and revise them accordingly. Another important framing I want to use, there's two parts of the slide that I think are of value, of particular value. One is we talk about the future, we talk about risks. Impacts imply to policymakers that we have a high degree of certainty, that we understand what's going to be the consequences of a variety of different changes, so we talk about risks. And when we talk about the risks of climate change in the health sector or any other sector, three factors come together to create those risks. One are the risks of a changing climate. How do temperature, precipitation, and other weather patterns change? A second is exposure. Exposure is used a little bit differently in other sectors. It means who or what is exposed. And that's pretty helpful when you start thinking about particular regions. The Arctic has particular exposure issues that are unique to the Arctic, different from what you see in small island states. And the third is vulnerability. Vulnerability changes from place to place. This creates a significant challenge for public health. We're very good at top-down programs. We're very good at saying we've got a problem with lead in gasoline and we take the lead out. We've got a problem with X and we go out and we solve it. With climate change, we have a tremendous amount of knowledge on how to manage the risks, but that will alter from place to place. And I'll show you that in quite a lot of detail. I'm going to do just a couple slides on climate change. I made sure that they weren't in Tony's slide deck so that you'd see something different. This is some work that was done by Peter Stott and his group in England. And they took weather data starting from the late 1800s, mid-1800s, when people started putting out thermometers and rain gauges. And the climatologists create what they call a climate normal. They take 30 years of data, and they use that as a baseline. And he created a climate normal for the end of the 1800s. Used Monte Carlo simulation, ran, I've forgotten now, it's 10,000, 100,000 runs through their climate model to say what would the climate look like if humans hadn't been adding greenhouse gases to the atmosphere. And that's the line that you can see. I suppose there's a pointer, but I don't know where it is. It's the line you can see. It's a squiggly line around the zero. The zero is the baseline, the weather in the late 1800s. And then they plotted the actual temperature change. And so it gives you a sense of how dramatic the change has been since the late 1800s. From a health perspective, it's useful to not only understand what these mean, but to start thinking about the implications for health, of thinking about the fields in which you work and what it means to have such a large change over such a short period of time. What does it mean to ecosystems? We heard about malaria in Kenya, and I'll talk about that malaria in a minute as well, of how a variety of vectors are changing their range because they're provided an opportunity with warmer temperatures. Didn't need to really put this in, but it's kind of a fun factoid. Climate Central does lots of great work trying to communicate climate and climate change. And basically by the 2080s, only 6 of the 19 cities that have hosted the Winter Olympics will be able to do so, just to give you a sense of the magnitude of the shift. There's also been a shift in extremes. This is some work from Daniel Ostrom, one of my graduate students, just graduated in Sweden. And he took these data from Stockholm. These are winter months. And I particularly like how he graphed this. He basically took distributions of weather from 1900 to 1929 and then essentially today. Of course, you'd expect a huge overlap, with which there is. On the left, you can see temperatures that occurred at the beginning of the 1900s that no longer occur. Not only these temperatures that your grandparents would have experienced, these are temperatures that various vectors would have experienced, like the tick that carries tick-borne encephalitis, a major issue in Scandinavia. And on the right-hand side in black are the temperatures that are occurring now that never did. So again, start thinking about vectors, thinking about the consequences for disease transmission patterns and what it means to have such a large shift in temperature. Public health has been managing climate-sensitive health outcomes for the entire history of public health. We've reduced the major approaches down to primary, secondary, and tertiary prevention, which are not understandable outside of people who've taken courses in public health. So I've put them down as reduce exposures, prevent onset of adverse outcomes, and response and treatment. On the left-hand side is a lovely cartoon I got from the US Library of Congress, and it is the city of New York. It's the port of New York specifically, and this is from late in the 1800s. In the 1800s, a major shipping port in the US was New Orleans. New Orleans had multiple outbreaks of yellow fever, and when you have an outbreak of yellow fever, there's quarantine periods for several weeks. And ship owners then are not that much different from ship owners today and didn't like their ships being in quarantine, didn't like bringing goods from around the world and having them sit for 2 weeks and could not unload them. And so this is more or less an advertisement from New York. You've got the port, you've got public health, who's an angel. It's kind of nice to have public health as an angel. Her shield says cleanliness. It says quarantine in the tape that you can't quite read, and at the bottom, you can see it says at the gates, and what's at the gates are yellow fever, cholera, and smallpox. And basically saying that New York had the public health infrastructure to prevent the kinds of outbreaks they were seeing in New Orleans. And so shouldn't you really ship to New York? And they were quite successful, which is why New York is a major port in the US. As I mentioned before, one of the real challenges for public health is tailoring our public health programs to meet local and regional needs. That we're not as good at this as we are going to become. That these top-down campaigns have been great, I will give you some examples on why it's really important to start thinking about the local context. As I pointed out, risk is a combination of not just the change in climate, the change in exposure, but also the change in vulnerability. The approach that's used in the other sectors that public health is starting to pick up is adaptive management. It's a recognition we're not solving this problem. It's a continuous cycle of understanding what the problem is, looking at our interventions, modifying them as we need to, monitoring evaluation to see how effective they are, back around to assessing. The whole time working with stakeholders because they understand the risks on the ground. For those of you who've seen me speak before, I almost always use this slide. It's audience participation time to wake you up after that lovely cookie you just had. This is a major flooding event in Mozambique. It was in the year 2001. About 1 million people were affected. 15,000 people were rescued from trees by helicopter. Took the government quite a while to get enough helicopters to rescue 15,000 people out of trees. A woman gave birth in a tree, and her daughter is famous throughout Mozambique. I saw a presentation on this event in 2002. There was one slide on the health effects. I swear that anybody in this audience, anybody who has thought about flooding for more than 5 minutes, can name everything but number 2 on the list of causes of morbidity and mortality. The leading cause of morbidity and mortality was the floodwaters themselves. You see what this looks like. It was a massive flooding event. When I do this with students, I make them try and guess what else is on the list. Do you guys feel like doing that today? Would somebody like to guess? You knew the answer. That's not fair. He knew the answer. So people always guess vector-borne diseases, undernutrition, water security. They guess the kinds of things that would be really, really important in a flooding event. What's also really interesting in US audiences, always somebody says snake bites, which says more about the US than it says about Africa. But the answer is exactly what Tim said. The answer is landmines. It was right after the Civil War ended. That's why I gave you the date. There was 1 million unexploded landmines in Mozambique, and mostly it was children who found them. So I can go in as an expert on climate change, I can work with people on flooding, but I don't necessarily understand the local risks. I don't understand how you take early warning systems, how you take traditional ways to manage flooding events without understanding what particular risks they face. There has been a very large increase in natural disasters. This is from the MDAT database. Kind of unusual way to present the data. It shows the number of natural disasters starting at the top in 1900 and going down to 2012. The biggest increases, as you can see, are in extreme temperatures and drought, in storms, and in floods. This has had a major impact on communities around the world, and trying to find ways to improve our disaster risk management, to make sure that humans are central to how we do management, make sure that we understand those vulnerable communities, that we understand that there's landmines that people have to pay attention to, and what needs to be done to further adaptation. Downloaded this last night. It's from NOAA, the U.S. National Oceanographic and Atmospheric Administration. I was hoping the text would be a little bit larger so you can see it, but these are just some of the climate anomalies just in the month of June. That Alaska had the second wettest June on record. Much of the Midwest has experienced an awful lot of flooding. My dad lives in Detroit. They had 6 inches of rain in 3 hours the other day. I was just talking to somebody in the audience that there was so much flooding, the overpasses were flooded to the underpasses were flooded to the overpass, that divers had to go out and make sure that none of the abandoned cars had anybody in them. I grew up there. I cannot imagine having to send out divers to check that there were no people in the cars. It's also something the city hadn't really put into their plan. Without looking at their plan, I can tell you they hadn't really thought about sending divers out because of massive flooding that they'd never experienced before. This is going to be a character of the next several decades. We do know from the climate science that there's an increase in the frequency, intensity, and sometimes duration of extreme events. And it's going to be critically important for public health to engage to make sure that we protect communities. I have the good fortune of being able to work with quite a few countries on adaptation. I'll give you an example about the whole issue about increasing in flooding and segue into another issue. It's a photograph I took last summer when I was in Vanuatu. You can see it's got a little bit of a hill to it. This is across from the main city. Every time there's a heavy rain, the hospital is in the middle of a slightly taller hill, and stormwater comes through the main hospital, takes untreated medical waste, and puts it out in the lagoon. They're seeing an increase in heavy precipitation events. They're seeing more of these events. And it's a really important issue of how then do you go about flood-proofing hospitals and who pays for it. It's been interesting within the international negotiations. There's been a bias that health will take care of the health-related issues, and yet hundreds of billions of dollars are going into other sectors. And so talking with some of the people who manage those funds of saying it shouldn't be the responsibility of the Ministry of Health to flood-proof a hospital. It's not their fault that these flooding events are happening. But it gives you a sense of the range of challenges that are out there and the number of ways in which people can engage to help solve them. Another issue that isn't talked about much in public health that comes up from working in small island states is food security. This is part of an absolutely massive project that was done looking at what's going to happen with skipjack tuna. And on the top, 2005, it shows you the average catch in tons in various places. And so the second is Federated States of Micronesia. The third is Papua New Guinea. And the bottom, it shows you by 2035 what's going to happen with what's the biomass change with below zero, obviously negative. Huge decreases. As the temperatures get warmer in the ocean, tuna's moving east. All the canneries are on the west, all the fishing is on the west, huge source of calories, complete source of protein for many communities. There's issues in adaptation, in climate change, that it's not easy to see how to resolve, of how to start changing diets, which, by the way, are not very great in the Pacific. They've got a huge obesity epidemic. But if you take away their main source of protein, what are going to be the alternatives? For another example, this is a picture of Bhutan. Bhutan is more or less a vertical country, goes from a few hundred meters to about 7,000 meters. And they're watching malaria change its range. They're watching malaria and dengue move up into highland areas. I had the amazing fortune to talk with some of the local community health workers a year ago, asked what they had seen in terms of climate change over the course of their lifetime. They're all senior adults, farmers. And one of them, I wish I'd had a videotape, who was just absolutely amazing, talked about when he was a kid, you knew it was time for the fall festival because there was snow in the mountains. And there's not snow in the mountains in the fall anymore. When he was a kid, they never saw mosquitoes. They were high enough up that they didn't really see mosquitoes. And the week that I was there in April, they were sleeping under bed nets. And the local hospital said the closest known case of malaria is less than 10 kilometers away. So very significant changes that the Ministry of Health is trying to figure out how to adjust their programs and plans to take into account. And we have, as Tim mentioned, there's lots of good evidence of why we're seeing these kinds of changes. This is some modeling work from Mercedes Pascual, University of Michigan, 2 different communities in Kenya. And it basically just shows as temperature goes up, mosquitoes replicate faster. And the number of mosquitoes, the number of Anopheles mosquitoes is a big determinant of how many cases of malaria you'll see once malaria is introduced. And it's not just the low and middle income countries, it's also all of the high income countries. This is some work done recently by the European Centers for Disease Control, asking where is Aedes albopictus right now And the red areas are where Aedes albopictus is established. The yellow is where it's been introduced, and the green, they don't have it yet as far as they know. This is really important because chikungunya was introduced into Italy a couple years ago, seems to have died out, but for those of you watching ProMed, there's been 15,000 cases of chikungunya in the Caribbean. It's been introduced into the Caribbean, and it's just moving from country to country. And so Europe is getting prepared for another reintroduction and looking at where they might have risks of seeing patients. And it's not just chikungunya, it's also dengue fever. There was a expert elicitation in Europe asking various experts what they were concerned about in terms of infectious diseases and climate change. This was weighted by the strength of the evidence of an association between an infectious disease and weather patterns and the potential severity of an outbreak to society. And you can see in the upper right-hand corner, the highest concern is Lyme disease. They've also got concerns with dengue fever, tick-borne encephalitis, various vibrios, and leishmaniasis. And so they're using this to adjust their policies and programs. This is some work that was done for Europe to looking at how dengue could change by 2050, includes climate change and GDP. You can see the red areas are places where it's likely that dengue will expand, and the sort of bluish color areas are where there might be a contraction. And so we're going to see these shifting patterns of diseases expanding in places, contracting in others, which means our public health programs have to be paying attention to this. And you have to really be paying attention to understand how these risks are shifting. Tony mentioned earlier there was an outstanding example here in Anchorage, a Vibrio parahemolyticus outbreak when the temperature out in the Sound reached 15 degrees C, hard temperature replication limit for Vibrio. The health department here did an absolutely outstanding job. They were not prepared because at that time the closest known case was 600 miles, 1,000 kilometers away. Not something that would be high on your list of priorities because it is so far away, but we are seeing these big changes. How are we managing these? Not as well as we should be. Public health has been very slow to engage in climate change. Here's another example from Europe. If you look in A in the upper left-hand side, the question was how many of the countries in Europe had had a national assessment, where blue is all the countries who've had national assessments. B, to the right, it asks which ones of those included infectious diseases. In the blues, you start seeing there's fewer that have included infectious diseases. How many have got planning and coordination? In C and D is surveillance. What needs to be done with surveillance? So even in Europe, which is about a decade ahead of the US in working on the health risks of climate change, they see a big need to start thinking about what these risks are, how they could change. And finally, I'm pretty sure that Kirk will say something about mitigation, at least I hope he does. So I put this in as the, if there's time for questions, I'm gonna put this up, then I'm gonna put up two sources of information of the number of people who are already affected in a number of ways by climate change. And to help protect people today is through adaptation. In the future is a focus on mitigation, but we're also going to need to do an awful lot of adaptation for all the risks we're not going to be able to reduce. And with that, I'm going to put up two slides. Oh, there's a quote I love from Charles Darwin. It's not the strongest of the species that survives, nor the most intelligent. It's the one that's most adaptable to change. And there's two sources of information around vulnerability and adaptation assessments. Both of these are WHO documents. This came out a year or so ago. It is a whole guide to do vulnerability and adaptation assessments. And the next one is something that's a discussion document. It's not quite ready to be released, but is available for doing health adaptation planning. And I can leave these if there's time for questions. Thank you.